Still letting in.
I think everybody's in now.
Talk to you later. I gotta.
Let me know when you're ready to start.
We're ready to go.
Okay. Good afternoon. I'm pleased to be joined by the Chair of Health and Government Operations Committee, Shane Pendergrass, Delegate Ariana Kelly, and representative from Planned Parenthood of Maryland, President Karen Nelson, Dr. Kali Bukowski, and Ali Spain. Today, we are here to talk about a very important issue enshrining reproductive liberty into our Constitution. Since the Supreme Court has allowed some of the most restrictive abortion legislation we've seen in a generation, right now, more than 36 million women across the country could lose critical access to reproductive health care. Restricting women's family planning options is dangerous and unacceptable. We will do everything we can to make sure that women's reproductive health care is always protected in Maryland, and any woman seeking care in our state has access. This session, we introduced bills that codify Roe versus Wade in Maryland's Constitution and provide the necessary funding and policy to changes to make sure that there's broader access to reproductive health care. A constitutional amendment will go to the ballot where I'm confident that voters will send the message loud and clear that this is a fundamental issue of liberty that cannot and should not be chipped away or bargained for. That was Speaker Mike Bush's message in 2019 when he introduced a similar constitutional amendment. And I'm proud to sponsor this bill in 2022. Regardless what states around us do, Maryland will ensure that women have access to the care that they need. I'll now turn it over to President and CEO of Planned Parenthood of Maryland, Karen Nelson.
Thank you, Speaker Jones. Thank you so much. Today, we applaud you for your leadership and for your vision to acknowledge that the current laws must be strengthened. And they have to be strengthened if we want to protect women's reproductive health care here in Maryland. I also applaud our committed partners in reproductive health, Chair Shane Pendergrass and Delegates Kelly, Pena-Melnick, Cullison, and Rosenberg for being our bill sponsors and for being all around leaders, all of you, leaders and fighters for women's health. 49 years ago, the US Supreme Court landmark decision in the case of Roe v. Wade recognized that the constitutional right to privacy exists and recognize that this does extend to a woman's right to make her own personal medical decisions. And that includes the right to have an abortion without interference from government. The recent challenges to abortion rights, including in Texas and at the Supreme Court, should really be a wake-up call to everyone. If there are challenges to laws that protect the rights of women, what rights are next? And what other rights could be reversed? Which is why now, here in Maryland, is not the time to rely on others to ensure that our rights and our freedoms here in this state are protected. We need continued protection and the broadening of access to abortion care here in our state, and we need it now. Abortion is healthcare, and healthcare is a human right. And access to abortion care is clearly a civil right. You may say, well, is this not a problem here in Maryland? Is this a problem? In our health centers, we see everyday obstacles, those most marginalized who are seeking healthcare, and they're met with barriers, rural residents, low-income communities, and women of color. And this needs to be a grave concern to all of us, because if we don't take active steps now, and we find ourselves in a world without Roe, those who have will continue to have, and those who have not will continue to have not. The threats to overturning Roe v. Wade are real and should be taken seriously. So today, we are going to celebrate the introduction of HB 937, the Healthcare Providers Training Abortion Care Access Act, and HB 952, the Healthcare Insurance Medicaid Access to Abortion Care and Health Insurance Act, and HB 1171, the Right to Reproductive Liberty, which will codify all of this. And all of this is so, so important because the legal right is key, but if you don't have access, it doesn't mean anything. So we need it together. So today we celebrate the proposed legislation that will ensure that Maryland has enough abortion providers and ensure that abortion care is covered like any other healthcare service. We must insist that abortion access is more than just making abortion care affordable. We must also insist that having access to a trusted provider within your own community is just as important. HB 937 will provide much needed training and expand the number of licensed medical professionals who will be able to serve those seeking abortion care. HB 952 will ensure that Black, Latino, Indigenous, rural, and low-income communities will get the same level of care as white or higher income communities. And it does it by creating equity in insurance and Medicaid and eliminating any obstacles or harmful waiting periods. I just want to close with saying at Planned Parenthood, we know that every pregnancy is unique and every person's circumstances are different. We trust our patients to know that they know their lives best. It's their body, their future, their abortion. So today and every day, we do everything we can to ensure that every patient who seeks an abortion can get one. And we'll do this with our partners here today from the House of Delegates. And we'll do it in our health centers when we open our doors with expertise, compassion, and dignity. Thank you so much, Speaker Jones. And I am now going to turn it over to the very bold and a person with much forethought, and I turn it over to Ariana Kelly.
Thank you so much, Karen. So I'm Delegate Ariana Kelly, and I'm here today to talk to you about House Bill 937 and 952. I want to also say thank you so much to Speaker Jones for being proactive and working to ensure that women in Maryland have the same rights that we have always intended for them to have. A little walk through history. In 1973, my mother was a high school senior. And actually, she had just graduated from high school in 1973. She remembers the time before Roe versus Wade. In 1992, when we had the Question 6 referendum on the ballot in Maryland, I was a high school junior. And today, 2022, 30 years later, my daughter is a high school senior. We are 3 generations of Maryland women who have lived after Roe versus Wade and benefited from that. Back in 1992, when Question 6 was on the ballot, I was so happy to find that 62% of Marylanders agreed with me that Maryland women had a right to make decisions about their own bodies. Today, when you poll that, the answer would be about 72%. So the Speaker's bill, House Bill 1171, that's going to elevate the legal right we have to abortion in Maryland to a constitutional right. It's such an important statement today. In addition to elevating that right to a constitutional right, though, we want to make sure that, as we heard from Karen, we are recognizing that the legal right to something, or even a constitutional right to something, is not the same as access to care. And we need to make sure today, in the face of what we are facing, that women in Maryland are still able to access care. So what does that mean, right? in 1991, when we did the original referendum on abortion in Maryland, we had 52 abortion providers across the state. Since then, that number has dropped to 44 providers. This is according to the Guttmacher Institute. That's a 15% drop in the number of providers, while at the same time, we have seen a 28% increase in the population. So we have clearly been going in the wrong direction. 2 out of 3 Maryland counties have no abortion provider right now. That's not what Maryland needs to be doing. If you look at other states, other northeastern states with similar abortion laws, you will see that they have much better coverage in terms of access to care. Maryland has 70% of counties with an abortion provider. We have 30%. It's reverse from where we need to be. And this is all what is happening on the ground in Maryland before we consider the impact that you just heard about from Karen of the Supreme Court case and the Texas abortion law. We've seen this decrease in providers. It's important to note because abortion care providers and their patients have been facing very hostile environments and increasingly aggressive protesters, harassment, threats, even violence at work and at home. It's just not right. When the Supreme Court decision in Dobbs comes back this spring, we're expecting 26 states to ban or severely restrict abortion. In the first month after the Texas abortion law went into effect, wait times for patients at clinics in Louisiana, New Mexico, and Oklahoma increased between 19 and 23 days. Clinics in Maryland are seeing patients from Texas already too, every week. And this pressure on our providers will increase dramatically as more states restrict or ban abortion. That's why we have the Abortion Care Access Act and the Abortion Care Access to Insurance Act. House Bill 937 is the Abortion Care Access Act. That is going to increase the number of qualified providers we have here in Maryland. It does this in 2 ways. Number one, it's going to remove an outdated legal restriction in Maryland that prevents nurse practitioners, nurse midwives, and physician assistants from providing abortion care. That's going to allow Maryland to join 14 other states that allow advanced practice clinicians to provide abortion care. It's consistent with how we approach qualifications for other healthcare procedures in Maryland. It treats abortion care as what it is, healthcare, without any unnecessary political restrictions. It's important to note that Maryland's OBGYNs are strong supporters of removing this outdated restriction. The legislation is also going to support clinical training so that we can help Maryland's physicians and nurse practitioners who are educated in other states like Texas or Mississippi who haven't been able to access clinical training in abortion care. We're going to see more states who are preventing their providers from accessing the clinical training. If you go to med school in a different state but come here to work in Maryland, we want to make sure you have access to that clinical training. The second piece of legislation, House Bill 952, the Abortion Care Access to Insurance Act, is going to increase the ability of all Marylanders to access abortion care by removing financial barriers. I think the speaker said it best, right? Any woman seeking care should be able to have access. This bill is really important. It ensures that Marylanders have equitable access to abortion coverage, whether they have private insurance or Medicaid. For the private insurance plans, it requires all plans, except for those with legal exemptions, to cover abortion care and without cost sharing or deductibles. We know from research that cost sharing requirements delay access to care. Eliminating that barrier is going to help women access care. For Medicaid, it makes our existing abortion care coverage permanent instead of subjected to a budget bill debate every year. Low-income women do not have different fundamental rights than women with private insurance. This should not be up for debate every year. It also removes stigmatizing policies such as the one that requires rape survivors to file a police report in order to access abortion coverage under Maryland Medicaid. This legislation is cross-filed by Chairman Kelly in the Senate Bill 890. With that, I just want to say thank you so much to the speaker for her incredible leadership, and of course to my chairman, Shane Pendergrass, as well, for their incredible support of this legislation.
Okay, and now we will hear from Dr. Kyle Bukowski.
Good afternoon. Thank you, Speaker. I'm so happy to be here. My name is Dr. Kyle Bukowski, and I am a board-certified obstetrician gynecologist and serve as the Chief Medical Officer for Planned Parenthood of Maryland. I join you today to give a clear picture about abortion access and what that means. And as Karen and Delegate Kelly have already mentioned, while the right to abortion is still maintained in all 50 states for now, we know that access to abortion limits that right for many Americans. Access means having enough trained providers within your community. It means overcoming the barriers and burdens that policymakers have heaped onto patients seeking abortion care, despite no policy ever showing improvements in safety or reductions in maternal mortality. Access means making sure that Black, Latino, Indigenous, rural, and low-income communities get the same level of care as white or higher income communities. The fact that abortion is not well integrated into primary care in OBGYN settings in the United States greatly contributes to the shortage of providers offering abortion care. This provider shortage begins with training, with less than half of medical schools offering students hands-on clinical abortion experiences. It is then compounded when interested students may not have access to abortion training during their residency, forcing them to pursue special fellowships or additional training after they graduate. And then it's further worsened when they try to look for a job where they may not be able to offer abortion care within their practice. They may have to practice at a different location to provide abortion care, or they may not have a facility to offer this. One strategy to address this provider shortage is utilizing advanced practice clinicians, better known as APCs, which include nurse midwives, nurse practitioners, and physician assistants to provide abortion care. These healthcare providers can prescribe medications, diagnose illness, treat complications, and perform medical procedures. And there is ample evidence that APCs can also safely provide in-clinic abortion, a simple in-office procedure that takes 5 minutes and is like other procedures that APCs already perform, such as insertion of long-acting birth control like IUDs. Allowing APCs to provide abortions would be especially helpful in rural areas where APCs tend to be one of the community's only primary care providers. People need abortion providers in their communities now, and those providers need improvements in training and removal of unnecessary regulations. Whether or not the Supreme Court explicitly overturns Roe v. Wade in the coming months, the damage has already been done, and we cannot be complacent here in Maryland. That's why it's especially critical to take proactive steps to broaden access by changing the definition of who can be an abortion provider. The abortion access care package discussed today will ensure that Maryland has enough abortion providers. Abortion access shouldn't be based on your zip code, yet 2/3 of Marylanders do not have abortion providers in their county. Abortion is healthcare, and it is essential for the safety of our communities. We must continue to talk about it, and we must pass the abortion access care package. I appreciate you letting me speak today, and I will now pass it to my wonderful colleague, Allie Spain, who is our practice coordinator at our Baltimore Health Center.
Thank you. Good afternoon. My name is Allie Spain. I'm a practice coordinator and an abortion provider in Maryland, and I wanted to highlight the importance of lifting Medicaid restrictions around abortion care. I was working at the front desk when a patient arrived for her appointment. I checked her insurance to make sure it was active, and the patient was good to go. I read the notification that the patient's Medicaid did not cover fertility or abortion services. I let the patient know and presented her with options, which included paying $390 out of pocket to continue her appointment or rescheduling. I also gave her information for funding sources if she needed to reschedule. The patient became upset and tearful, explaining that this was the only day that she could take off work and have childcare covered for her other children. I could see that the patient was struggling and trying to comply with the strict schedule that individuals working paycheck to paycheck have to obey. The patient asked if there was anything we could do, and again, I kindly explained that the options today were to pay $390 or reschedule. The patient began to call friends and family members out of desperation to have someone loan her the $390 and was becoming more and more upset. It was extremely difficult to watch this patient have to tell her friends and family that she was here for a time-sensitive appointment, such as an abortion, when the patient wished that she could have kept this information private. Other patients in the waiting room also witnessed this patient crying and trying to problem solve, which made other patients more anxious and also led to delays in their care. The patient eventually needed to reschedule, which I helped her with as she was crying. I empathized with her and validated the stress she was going through, which made her more emotional, although the patient was able to see that this was not the clinic's fault, but a hurdle in her insurance coverage. It is also worth noting that by rescheduling, the patient lost money by taking another day off work and arranging cost for additional childcare. As someone who works in a reproductive healthcare office, this is not the first time I have experienced this kind of situation, and staff other than myself handle situations like this frequently. As someone who is watching the patient struggle to receive the care that she needed, I wish I could have paid for her appointment or tried to help with childcare, but I know professional boundaries make it so that cannot happen. Clinic staff also struggled to not become desensitized to situations like these because they happen so often and are so upsetting. My colleagues and I want to provide the best care we can, and it is extremely upsetting when a hurdle in someone's insurance coverage makes it so we cannot do that. We care deeply about our patients and the care they receive, and patients deserve the right to receive the health care they need without coverage issues dictating that. The Abortion Care Access Act of 2022 will mean that patients will get the care they need when they need it, and providers will be able to provide compassionate, respectful care on the patient's timeline. Thank you.
We will now turn to Chair Pendergrass for remarks.
Thank you, Madam Speaker, and thank you for your courage to bring this back this year, and all of you to all of the good work that you do and what you bring to this issue to help the women of Maryland. The Maryland General Assembly, as you heard, passed legislation in 1991 to protect a woman's right to choose. It was petitioned to the ballot in 1992 and known as Question 6. Maryland voters, including me, passed it overwhelmingly. I believe that by now we would be more enlightened society, recognizing a woman's right, working with her doctor to make medical decisions for herself. Unfortunately, I was wrong. The Supreme Court is likely to continue to erode, a woman's right to control her reproductive health care. These bills need to pass this year to protect access to abortion in Maryland. And with that, I'll turn it over to the speaker.
Right now, we are in our portion that we're doing Q&A. And so we will be handling them in the chat.
Well, so I think that
How are we doing that?
we can get everybody to use the hand raise function and
Hand raised, okay. Okay. all
yep.
right.
So we have our first question from Pamela Wood.
Hey, good afternoon. Thank you, everybody. Appreciate this. I was hoping you could provide some data points in terms of numbers of providers in the state, as well as number of abortions performed, and if that could be broken down by procedures versus medication abortions, if anybody has that. Thank you.
I have the provider data. I do not have the procedures data, so we can start with that. We have right now 44 provider locations across the state. Now that could be a provider that's a larger clinic or a solo practitioner shop, but it is 44. And that's according to Guttmacher Institute, who tracks that for us and every state. I can also tell you that, and I have an infographic that I can share with you how that compares to other states on the East Coast. So I will make sure to circulate that, but we are not doing well in terms of counties with no abortion provider. So in Maryland, 71% of counties have no abortion provider. If you were to look at Maine, which is a rural state, only 31% of counties have no provider. They allow advanced practice clinicians. So that's one of the ways they have addressed that issue for rural areas.
And then according to Guttmacher as well, there were 29,800 abortions provided in Maryland in 2017. I would say matching the national trend, we're seeing about just over 50 to 60% of abortion being provided as medication abortion, as that tends to be more accessible than the rest being in clinic abortion.
Great. Thank you so much. Appreciate it.
We have a question from Callan. Go ahead.
Hi there. Can you hear me?
Yes.
Great. I'm sorry. I'm having some camera issues, so I figured I should just keep my camera off. Is this legislation at all connected to Senator Saling's Equal Protection of Unborn Human Beings Act of 2022.
Want me to field that one too? It was not inspired by that at all. It was inspired by the situation that we are in right now in the national landscape. So no.
Thank you.
I believe a question from Rob Lang, WBAL.
I want to apologize for the camera. It seems kind of dark, so I apologize for that. I'm going to direct my question to Dr. Bukowski or to Allie, but anybody else wants to answer it, please do. How is the Texas law and other states where there are further restrictions on abortion impacting your practice and others? Are you seeing more patients coming from other states to Maryland to get abortions? And I realize in Texas, that involves a plane ticket and possibly a rental car and a hotel, and that gets more expensive.
Thank you for that question. We are seeing a handful of patients from Texas specifically coming to our health centers, and those are just the ones that we are aware of and that they're self-reporting. What we've seen nationally is a large proportion of patients are traveling by car to the local, kind of the closest clinic to them, which is why we've seen a 400% increase in Oklahoma, New Mexico. Of course, when SB 8 went into effect, it was right after the hurricane hit Louisiana. So the Gulf Coast was obviously impacted both by climate issues and these issues. But what we've also seen is that patients are traveling to where they have support, right? So if they have a cousin in Baltimore that's a safe place, or they have financial assistance, you know, a Southwest ticket is potentially just as accessible as an 8-hour drive to a state that actually has other restrictions such as waiting periods or lack of, you know, insurance coverage or things like that. So we're really trying to figure out this landscape also to plan for what could happen if we have an unfavorable decision from the Supreme Court, to know where people are going to go from these 26 states.
Thank you. Unless anyone wants to answer, I appreciate your time.
We'll take a question from William Ford.
Thank you very much. Appreciate it. And that, as you all know, abortion can be a real ugly issue. And then I'm asking much straightforward question for any of the lawmakers. Do you have the votes the confidence that this will pass this year? Thank you.
Okay, I'll take a stab at that. I'll step up. Or were you going to, Madam Speaker? Okay. I don't think we've counted the votes today. I think that we believe we do have the votes to pass this. We think it's important enough that we need to have not only us doing our job as people who represent other people, but people like the other people in this room who are integrally involved in helping people get the healthcare that they need. All of these organizations, I assume, will be mounting their best campaign to educate people, to let them know what's at stake. And this press conference, thanks to the people from the press who are here today, will be the first step in that. And of course, legislators are elected by the citizens, and we listen to our citizens. And as you know, this is a very popular right that women want to have and men want women to have.
Great. I think the final question from Hannah Gaskell, Maryland Matters.
Hi, yes, thank you so much. I know that there is another bill. I joined a little bit late, so I might have missed this, but HB 626 sponsored by Delegate Williams, and it's co-sponsored in the Senate by Judicial Proceedings Chairman Will Smith, that seeks to provide protections for people seeking out abortion services or experiencing miscarriages against legal repercussions. Has there been any discussion with those lawmakers about the policies that you're also putting forth?
I can answer that if that's what the speaker wants. So yes, that legislation is separate from this package in part because it is much broader. As you mentioned, it deals not just with abortion, but also miscarriage and other types of pregnancy loss. And it is not a healthcare access bill, so we're not considering in this. That being said, we've been working very closely together, and Delegate Williams is a co-sponsor on these bills and a strong supporter of these healthcare access bills.
Thank you.
Okay, I think, thank you for your time. We're all set here. Speaker, do you want to close us out?
Unmute myself. I appreciate everyone who came aboard to get some information for this very important topic. Just stay tuned. Follow when the hearings will be taking place. Follow both the House and the Senate. So you have a full picture of what the General Assembly is doing in this area. And I appreciate you taking your time, and thank you for our sponsor, our bill, our chairman, and everybody here today. Enjoy the rest of your afternoon. It's not snowing now.
Thanks, everyone.